T-cell lymphomas are diseases that are difficult to treat with the typical chemotherapy agents that we've been using for decades right now. The prognosis is poor, and when there are responses, they are short-lived. So we are all, as T-cell lymphoma specialists, are trying to find ways to tackle this disease in novel ways. We've learned, based on studies done by our group, that the tumor microenvironment, so the environment that is surrounding the tumor cell, is pretty rich. There are a bunch of inflammatory cells that are there that are supposed to actually fight the cancer cell, but they appear not to do their job. There are things that are suppressing their function, and we believe that by modulating that microenvironment, we may be able to treat the disease differently and maybe improve outcomes for these patients. So basically, the study is a three-part study. The major, one of the parts is part of a clinical trial where we are studying blockade of checkpoint inhibitors, use in T-cell lymphoma. But we are not going to do it alone. We are going to combine it with romidepsin, which is one of the HDAC inhibitors that is approved in T-cell lymphoma. And the goal is to get some synergy between these two drugs to lead to improved responses. And as we are doing that, we are going to collect blood and tumor samples from these patients so we can better study how these drugs are affecting the immune system and the tumor microenvironment, and how we can find ways to predict who are the patients who respond or do not respond to treatment. So in a gist, this is what the study is about.